We have Marcus Coleman now jumping in. Marcus, how are you doing? We finally got you. Appreciate your patience there, Senior Associate at HWC Incorporated. So offer some, and oh, also, by the way, real quick before I go to you, Marcus, for those who are attendees of this micro summit, of this special micro summit that we are convening right now, if you have questions, if you have comments, provide any feedback. One, keep it very classy, keep it very civil. So we want to have civil discourse here, but you can definitely keep it straight with us, keep it real with us. We appreciate that, but keep it classy. So one, but two, you can do that in the Zoom webinar chat. We have a Zoom webinar chat. Please start doing that now. I'll definitely start transitioning or shifting over there and relaying those questions or throwing those questions out to our panelists. So Marcus, as you're listening to all of this, wanted to get some of your thoughts about, sort of the expectations that you have, for a summer that we're coming in on like this. I did say pandemic and protest, unrest, and also we're worried about climate crisis. With respect to when we think about that, we think about flooding and hurricanes and tornadoes, but then we got urban heat islands. That's going to be a real big issue. It's going to start heating up very soon. But, sort of want to get your thoughts on meeting the demands of that, Marcus, but also the strain that this has on that emergency response supply chain.
Thank you for that, Charles, and happy to be on. I think the timely topic, and as we talk about preparedness, I think one of the things we also need to prepare for is connectivity issues online. So I actually want to pivot it back. I think one of the things as you're talking about the strain, I think ultimately what we're seeing is a strain on his livelihoods across the board as well, right? So for example, with the emergency response system, every emergency responder, every first responder in some form or fashion is entering now their fourth, fifth, or maybe sixth month in helping to respond to the pandemic, on top of some of the other things that are happening. But we know for the individuals, for the families, and for the organizations that have been helping to support the lives and livelihoods of others, they've been strained as well, right? So I think I appreciate Ms. Brown uplifting a little bit of their work for 211 and what's happening with Lifelines Alabama. I think one of the things that we want to be talking about at this point, right, and what are some of the boundaries that we can set or some of the roles that we can either define or redefine that really helps us continue to engage for the long haul, because the disasters will compound and they will be complex. Many people may have forgotten that leading up to some of the major announcements for COVID-19 hitting the United States, you actually had the state of Tennessee reeling from impacts from a tornado in Nashville. And so you had organizations like the National Association for the Advancement of Colored People already trying to respond to some of the tornado impacts, while also trying to determine and figure out at the time, how do we do some of the practical steps to provide services for food, for shelter, and making sure that people were able to get some of the access that they needed in the context of what was and still is a very volatile landscape with the pandemic. The Federal Emergency Management Agency, to their credit, has continued to lead and starting to lead on how we can think about some of these implications. It is not a perfect document, but they do have a document that speaks to when we're thinking about providing, again, essential services in times of emergency, food, water, shelter. What are some of the considerations that states, localities, and counties should be having as it relates to providing those services? I'll drop that link in the chat, Charles, as I always do. But those are some of the things that we're thinking about. I'll say the last piece that I want to touch on a little bit is there's a large mental health, emotional health, and spiritual health aspect of this that's affecting our frontline leaders, including those faith and community leaders that, again, they've received calls every day. You have people that are not able to practice their religious services and religious observances in the way that they would prefer. And I think that there's definitely a struggle to try to help reimagine what it means to maintain social connection in this time of social distancing. And so that's another thing that I think is being mindful of. And thankfully, we do have some tools, resources, and partners that, again, are very much looking to provide some of those support services as well. And I look to organizations like Healthcare Ready and Chandra's group that are providing, I think, some of that initial support. And so one of the things that I'm thinking about from an emergency manager standpoint in that supply chain question is, how do we help care for the caregivers or support those people that are providing those vital support services? And that does require a little bit more investment from other partners.
Senator, I want to go to you. The front line, Marcus, that's another term that's been, thrown around quite a bit, especially during this pandemic. And when I think of front line, I think about a lot of marginalized, vulnerable populations that have always been on the front line. We don't find out until these disasters strike that vulnerable Black and brown populations have always been on the front line, or the most disproportionately impacted when say like major hurricanes or an earthquake like what happened in Puerto Rico hits. And so I want to get your perspective from someone who's in the position of the leader of the legislature. You were at the center of the maelstrom in terms of trying to coordinate a better, more effective local, state, and then federal response. But what happens there? Give a little bit of your perspective about when there is a failure on the part, particularly from federal partners or from a lot of that emergency management response, when there's not a whole lot of insights into the struggles of vulnerable or marginalized communities when dealing with disasters like this. We had a bit of taste of that from 2005 with Hurricane Katrina. We seem to be constantly getting into a repeated loop on this conversation. Every time big disasters happen, there is a failure to understand or to have diverse peoples in those emergency management planning rooms.
Oh, did you hear the actually bullseye? First thing that happened in Puerto Rico, and we found out real quick, we live in the island. And FEMA came over and they said, well, we're going to take over the whole operation. And then a few days later, they realized they don't know where to go. So they came back to the state government and said, well, what can we do together? That was like 5 days later. And then we have the issue about poverty communities that we knew they were there, but then something else came up that it hit me by surprise, being majority leader of the Senate, is people in the middle class that look fine from the outside. Fine houses, fine communities. Once we came in, they were vulnerable. They were only a paycheck away from being poor. So they were living off the credit cards, and that meant that they have the same needs of the people with the thin roofs. So what happened is we had to put them all together because they were in the same need, and FEMA did not understand that. So the federal government came up and they said, well, we have some guidelines, and this is what we need to follow. For example, first thing they did 48 hours after they came into the island, they said, we need to file a form to the internet. And we have to look at each other and say, well, we have no electricity. How can we do that? They said, well, that's the guideline. You need to file it to the internet. And it took them about 2 weeks to find out, okay, so we need to find out some other way to get people's information. That was 2 weeks after. So we have people in trouble already. When it comes to brown and poor people, as you know, Puerto Ricans, we have a mixed race, but we do have a couple of towns that are Black, like Loíza. You probably saw it on CNN, and guess what happened? They were left to the end of the line. And it was private partners that came in and they said, let's work on it right away so we don't have people dying. As you know, we have over 3,000 people that did not die directly from the impact, but died because of the negligence and the collapse of the government, including my government, the state government, because we couldn't cope with the volume of help coming from the outside that was unorganized, the federal government taking over the ports and saying, well, we're going to do it a federal way, and the local governments and me as a senator representing 500,000 people that knew where the poor communities were, and they weren't able to get help because of the technicality and the bureaucracy from Washington. And quick example, we have, our land is very, very pricey, as you can imagine. And we have a lot of people without titles. FEMA will not give you help if you don't have a title to your house. But we do have people that live there for about 50 years, generation to generation, is their land, but because of that technicality, they weren't able to get help. So we had to come up with something new, and that was to give some affidavits saying, oh, well, you were living there before the hurricane, therefore you're entitled to help from the federal government. So at the end of the day, logistics, once again, lessons learned. We know where people were. Federal government cannot do it all, even though they have the guidelines.
Right.
It's the state government, it's elected officials, it's the community leaders that are first responders to any tragedy, in my opinion. That's something that we learned real quick after Maria.
Logistics are very important now, and also a delegate too. You know, speaking from the perspective of Baltimore, dealing with the kind of populations you have to deal with. You know, very it's a mix, right? You know, from low income,
right,
to middle class, being a majority Black city. And so, you know, but that cultural competency, that cultural, socioeconomic, racial competency piece is just so key. Talk about that.
Well, also, many of your listeners may not know, but with the fastest growing population in Baltimore City is actually Spanish speaking. And, you know, we have a foreign language map of Baltimore, so we have a better sense of where people are speaking certain languages across the city so that we can tailor our communications and our outreach around particularly the pandemic more strategically. However, our Spanish-speaking population is at least more geographically cohesive. And we realized as we were deploying food and other resources across the city, it was actually our first window into an emerging COVID hotspot within Baltimore City. And in a neighborhood called Highlandtown. Though it's not in my district, it's not very far from my district, actually. And I think what we realized is that a lot of the communications pathways that our city had traditionally relied upon was not meeting the needs of this population. So I think that's something that cities have to kind of freshen up what their outreach and what their communication pathways are. What maybe worked in the 70s or maybe even worked 10 years ago might not be as fresh and relevant as populations continue to evolve and as you get a better sense of what people rely upon to get information. I would say that the fact that we're in the midst of responding to the census is actually a really good time for cities to get a better handle on how they reach out to the public, because the census kind of gives you that focus every 10 years about, oh, people are reading that, they're logging on to that, things that you may not spend a lot of time analyzing as a locality. It gives you that fresh chance to think about that. So for us, we realized that you might have a population living in your city that's relying on a messenger outside of your city because of common ethnic ties, religious ties, and things like that. So getting the right messenger might actually require you to go to that imam or that pastor that doesn't even have a faith house in your city, but it could be where people in your community routinely get information that they trust about what are their best steps forward. Another thing is that right now, people are getting a lot of information, right? So that's one of the challenges too, is that there's almost a preponderance of information and they're trying to distill what's really important to me, what I really need to apply to my life. So last night I co-hosted with the Maryland, the Legislative Black Caucus of Maryland, a 90-minute program just focused on COVID-19 and what it means for Black Marylanders. And one of the things that I think was an important takeaway for people tuning in is that access to testing is kind of tweaking our understanding of the rate of increase. So of course, if we don't have tests, how do we appreciate the rate of increase? So sometimes the same statistic that can be used to give someone a measure of comfort, when you better understand the context of the information, you might realize maybe I should not be as comforted as I originally led to believe. So we're really, I think, trying to use our platforms as state elected, as the body, because we have within our state legislature not only a Black caucus, this is actually our 50th year, so if there was ever a time to be activated as a body, this is a year, right?
This is that time, exactly.
Yeah, we have a Latino caucus and an Asian caucus, so we're also trying to figure out how can we work together for cross-cutting messages that meet people where they are.
Right. And Sarah, tell us about, there's something called a national mass care strategy. And what does that mean for a variety of communities, you know, particularly when we're talking about those vulnerable, marginalized communities on the front lines. But, you know, what is a national mass care strategy? What does that mean when suddenly communities have to shelter in place, or, you know, like we've had to do with the pandemic, or then they need to evacuate, like in the case of, you know, when a big hurricane season hits? What's that mean?
Sure, no, and I mean, it's a big name, right? A national mass care strategy. Almost every word in that title is a lot to take in. And so national mass care strategy is, you know, our approach, you know, the emergency response community approach to making sure households and individuals are taken care of in every sense of the word, during an emergency. So that's sheltering for you and your pets. You know, having a pet, a lot of times that's the reason people don't evacuate or have hesitation doing that. So it's you know, taking care of the hierarchy of needs, having shelter for you, your pets, your loved ones, being able to be fed, having the food, water like you need. Like Delegate Smith said earlier, people are always hungry during an emergency. Doesn't matter what the hazard is. There are some core principles throughout you know, these emergencies that people need. And so that's why in the emergency management space, we adopt what's called an all hazards approach to emergency management. So not developing mass care plans based on, you know, certain events. There are, you know, annexes for these events, but having a unified approach, no matter the event, no matter the need, to be able to take care of, you know, those human needs, shelter, water, food, having your medicine, having your emergency supplies, and all of your healthcare needs. That's kind of what that national mass care strategy tries to set a framework and a parameter for.
Here's a question. We're going to some questions in the Zoom webinar chat, and Chandra, I'll let you weigh in on this first. We have a question from attendee Malco Polo, who is wondering, how can citizens organize in cases like, for example, Hurricane Maria, and is leaving an example of when with Hurricane Maria, in the wake of that, thousands of water pallets left unnoticed for people in need in Roosevelt Roads Naval Base and Sullivan, Puerto Rico, and other places in the island. Chandra, I'll let you weigh in on that. Senator, I'm sure you might want to weigh on that as well, since it's dealing with Hurricane Maria. But Chandra, go ahead. I mean, the larger, more fundamental question is, you know, because we've been talking about different agencies and institutions preparing and responding, but what about citizens? What can they do in a time like that?
I think we know our communities better than anyone else. So what do we see, you know, creating that connectedness prior to a disaster? I think that's important. Knowing what's out there and what we need, knowing our neighbors so we can stay connected. I think often what people don't do is they want to do it and they're afraid, you know, and so it's just the courage to step out there and do it. And to say, you know, I had a friend at one time after Katrina impacted the end of Mobile, the south end of Mobile. And so she called me one day and said, hey, I got to do something. 2 days later, she had called her church. She had called several other community groups that she knew. And she did one of the largest drives that were in this side of the Gulf Coast. Just by making a couple phone calls. And so I think often we don't realize that we have the social network and we have those social connections that I could call Delegate Smith, I could call Marcus, I could call Senator Rios and say, hey, look, I want to do something. Y'all are my friends, I know you, what can we come together and make happen? And often it's as simple as that. It's as hard as that, but it's as simple as that.
You know, Senator, before I let you in on that, I want to make sure all the panelists get equal time here. Marcus, yeah, weigh in on that, because especially in your position there at HWC and how you partner up with Healthcare Ready, and you've been talking a lot with on-site grassroots community organizations like, for example, NAACP branches, Urban League, Black churches, et cetera. So what your thought on that, you know, kind of piggybacking on what Chandra just said, as far as, you know, what citizens, what actual residents can do in attack, because we might just feel as individuals, as households, powerless, and to an extent that would be true in a disaster. But what are some of those steps that we can take as those individual households or as resident citizens?
No, thank you for asking that question, Charles. And it's something that gets more complicated by the day. My general personal creed in our household is the best thing that you can do is the thing that you do best. And so if it's as simple as just being that person in your family that's navigating some of the websites, we know that there's a lot of information out there, to Delegate Smith's point, that people are trying to navigate. So if you can pull some of those key resources together and help process it and make sense of those for your family, I think that that's one thing that you can do in home. I'll say the second piece, and Charles, you and I have talked about this throughout the course of our venture throughout this whole journey, right? Chores still got to get done. Like, life still has to happen. You still got to figure out how you're going to work together as a team and as a family to ensure that you're meeting the day-to-day needs. And then checking on your neighbors, as a few people mentioned, is a key thing. If we're pointing to some specific examples at the community level, so we have seen historically Black colleges and universities, Hispanic serving institutions leading from a place of research and academia, and we have people that are in these fields that are studying and looking at how to address some of these problems in work. And so to the delegate's point and to the senator's point, right, there are some local resources and local leaders leading well there. If we're talking about in the home, one of the things that we can encourage now, and Healthcare Ready has some great resources about this, making sure that all of your family members that do have medical prescriptions or that do have some form of medical care that they need, know what steps they can be taking to help reduce the risk of exposure to COVID on the front end, and have a plan for how they're going to continue to access those medical care needs in the event of other disasters that happen. Unfortunately, I think that has been a reality for far too many people who, in the midst of responding to the pandemic, may have lost their pharmacy, may have lost their ability to transport for their dialysis visits. And so if we're talking about in the home, I think one of the best things that we can do to show up for one another is to make sure that we're all healthy and well. And as I mentioned, you have organizations like Healthcare Ready that are providing some guidance. You have other organizations like the American Red Cross providing guidance, but then you also have faith organizations like the National Association of Latino Evangelicals who are providing not just mental and spiritual care, but guidance to pastors and faith leaders that are trying to determine, what does it look like for us to reopen, or what are some of the things that we should be thinking about and talking about with our local government leaders as the church. So those
Senator, definitely want you to weigh in on this question, but before I let you weigh in on it, because it is very much of a tricky balance, right? Trying to connect the grass tops, as I like to call it, like where you are, in the position as majority leader of a legislature, and the grassroots, the residents. But Javier Cuevas talks about, and Senator, I'd like for you to respond to this. Considering that we're in the middle of a pandemic, I see a lot of people in Puerto Rico ignoring the general order of using face masks in public areas. How can we compel people to use their, that's not just in Puerto Rico, I'm saying that everywhere. How can we compel people to use their face masks, since wearing them is so important in hindering the spread of this disease? And so, Senator, definitely, answer that question more directly, but it gets into a larger discussion about, once again, the role that the residents, that the people or individual households play.
Well, I'll see this like an airplane. You got to make sure you're safe first when you have an emergency. And then once you get yourself with the air mask and everything, then you take care of your neighbor. Coming from the beginning of the first question about what happened, why the water went to waste and all that. In the middle of the pandemic, it's about actually taking care of ourselves. I mean, government can tell you what to do, where to go, and what not to do, but it's up to you as a citizen to make sure that you're safe before you go out and help someone else. And coming back to weighing into the water thing in Puerto Rico after Maria, same thing, logistics. I mean, federal government tells you they will support it, state government's supposed to actually manage it, and local government's supposed to execute. That's kind of the guidelines. What happens is in these kind of pandemics and any other emergency is that people want to help. How can you actually organize and have the logistics to have help where it's needed? Because what we found out real quick, and I'm pretty sure you have in all the states, is that people say, well, I want to help my neighbor. And suddenly you have 10 resources, same resources, food, water, medicine, in the same neighborhood, but you don't have the same 3 miles away. So logistics is very important, making sure that you have what you need first before you come out to help your community. And that's very important in my opinion. And that's what happened in Maria. That's what's going to happen in COVID-19 if we don't do the same thing about organizing, having the community understand, be safe, take care of yourself. And once you got that down, then you can come out and help others. And that's something that helps out from the government standpoint.
We also have Sherry Willis, another attendee, asking, making the point, and I'm also asking about this delegate. Would love to get your perspective on this. To the point of what citizens can do. During the current pandemic, we've seen grassroots mutual aid networks spring up in DC and other localities. I have seen that in DC. I've seen that pop up in other major cities as well. I think Baltimore might have some things going on as far as that's concerned as well. Is there a way to harness the collective effort here and pivoted to future disasters? Delegate?
Absolutely. Within our city, we have not only a mayor's office of emergency management, but we also have a sustainability office. So they're kind of thinking a more long-term contextual way around how we can have sustainable systems for emergency response, and not just thinking in this episodic way that a lot of our systems tend to think. So to the larger point, while there has been a lot of city focus on the institutional apparatus to respond to this pandemic, the Office of Sustainability has really been focused on cultivating community and grassroots-led response leaders. Now, many of them are part of existing community and grassroots entities that could have been focused on something completely non-disaster related or even relief related. Some of them may have been organizations organized around concerns around social justice broadly. It could even be criminal justice specific. But in this moment, they have become the most trusted faces in their communities. I think something we haven't discussed as much as sometimes it's very hard to ask for help. And even though you know there's a government, and even though you know there are these officials that are supposed to provide this help, it can be very difficult to ask for it because of pride, all these things that are just human. So it might feel very different if Senator Rios is my neighbor, and it's not that he's a senator, I know him, I trust him, and I don't feel that same level of shame saying, can you give me a hand here? And we've found that there has been people who have otherwise might not have received some of the help they've needed simply because they're able to connect with a community and grassroots entity. So we've been figuring out how can we give them the PPE to distribute within their community, because someone else may not go to that giveaway that's being given out by the government. You get what I'm saying? And we're trying to figure out how can we even help with grant dollars. I mean, this is a situation where the government, bigger institutions, they usually have more capacity and more familiarity with the grant writing process. So for example, the Office of Sustainability in Baltimore has been able to secure an additional $65,000 just in the past month for grassroots community members to continue their food relief work and their urban ag work, because we realize that this is the perfect time for people to be growing food, but how can they make sure their food is going to go to the communities that need it the most. So I think there's a lot of different things, but I think the foundation community needs to kind of widen their perch of what they think is a worthy organization to give to, because I think quiet as it's kept, a lot of bigger institutions, the government included, have relied upon these grassroots and community organizations to be their validators and to be kind of their entree into some of these communities that need help. And we don't really have time for that. We need to endow the trusted messengers and the trusted entities with the resources and the support right now, and not always think that there needs to be a middleman. So I think there needs to be some institutional humility and some institutional assistance to kind of realize maybe they don't need to be the first person to get the resources. They need to make sure they go directly to those groups. And that's what we've been trying to do in Baltimore with different success, but I'm proud of some of the efforts that have happened.
Hey, speaking of institutions and the role that they play, Sarah, do we find that public-private partnerships have been working, especially during this time of the pandemic? Has it sort of enlightened us to new ways of doing things, partnering, new models? Have we learned any lessons during pandemic that we can apply now into the future, especially when we're about to hit some real serious climate crisis inflection points?
We have, and actually wanted to build on Delegate Smith's comments about, ways to plug in, and, communities can sometimes feel like either they have to go it alone, or, they're not sure, for whatever, for valid reasons, aren't able to plug in with government, don't want to. I think it's important to remember that there are other channels for volunteering your time, but also providing support. And I want to make a plug for what we call the VOADs, which are voluntary organizations active in disasters. There's a national VOAD that has national nonprofits that convene. There are state VOADs, so you can learn more about who are the members of your state VOAD, all the way down to local and regional VOADs. These organized groups of nonprofits, NGOs, where if you kind of to Marcus's point earlier, do what you do best. So if you want to volunteer your time on social media, if that's where you're comfortable, pushing resources there. If you want to volunteer your time distributing PPE, distributing food, these VOADs are a great place, to harness that community willpower that I think Sherry was mentioning in the comments earlier. And speaking from Healthcare Ready's role, we work very closely with, members of the NVOAD, the National Voluntary Organizations Active in Disasters. We make sure that we're plugged in with state VOADs as well. And so we see a lot of these public-private partnerships form and kind of manifest and grow there as well. And so I think the role of PPPs, these public-private partnerships, are helping, meet the, the goodwill and the resources of the private sector with the needs of the community and the public sector, and really help make those connections there. So did want to make sure we had a plug for the VOAD community there.
Chandra, you go a little bit further into this or deeper, and we may have, I'm going to kind of I know we're scheduled to close at about 11. We'll close maybe about several minutes after, so we got a little bit of time, but just more thought into how we're aligning emergency response, emergency management with the social justice dynamic, because there's the, so for example, pandemic showed up, we were just initially, especially just focused on, okay, triaging it, the public health dimension of it, but then we find out, oh, you know what? There's all these other issues, food insecurity, poverty, education disparities, et cetera. What's the kind of perfect intersection to coordinate or align the emergency response with the social justice, economic opportunity components?
That's a great question. I mean, I think Delegate Smith said it beautifully when she started, when she said she looked back at her memories and the same issues were going on. I think that's what gets frustrating. You know, the disasters just illuminate all the issues that we already know that are going. A perfect intersection would be that we continually worked on what the issues are. We continually worked on our, racial disparities and poverty disparities and health disparities. I mean, it's all like an intersection of like one builds on the other, builds on the other. So to me, that would be the perfect world, that we didn't have to wait to a pandemic or to hurricanes or to, tornadoes or whatever, that we're like, ooh, we have people that are poor. Ooh, we have this that's going on. Ooh, we never knew about this community that was off in the corner that we didn't know about, but we kind of did, but we just ignored them, right? And so to me, it would be, you always get to these points, and I always hope like, oh, I hope we'll continue the conversation, and we never do. And so to me, the perfect intersection would be we build upon like what we've learned, and we move forward to do something different, and we don't.
No, yeah, that's always the case. Hey, Marcus, you've got organizations on the front line, NAACP, HBCUs, and I've noticed you put a little bit of information in the Zoom webinar chat about 1890 land-grant universities, historically Black colleges as well, that are involved in emergency management response mental health organizations. How do we get more aware and more familiar with, well, one, what are the types of roles that those organizations are playing? How can we get constituents, residents more familiar, more aware of what those organizations are doing?
Absolutely. So I think if you're a leader, and I know that for the Council of State Governments, right, you have a lot of elected officials within this network that are probably connected to a lot of these organizations that you just mentioned in some other capacity. Many of our entities, including our Divine Nine organizations, the National Pan-Hellenic Councils, may have somebody that's appointed to help support with some of the disaster response or emergency assistance programming. So in terms of just getting more aware, I'll leave 3 points in terms of getting connected, finding ways to elevate, and then finding pathways to collaborate. So when we talk about getting connected, I just dropped to your point about the equity considerations, Charles. The NAACP outlined 10 equity considerations that provides a pretty robust list of not just considerations, but articles and partners that are leading in this work. That's a great conversation starter to get connected with maybe some of the stronger partners that you have. To Delegate Smith's webinar last night, I had another friend of mine who is also a delegate in Maryland, who has been leading on the front lines as it relates to housing and income assistance, right? And so she sees the intersections across the board there. when we talk about some of the elevation or some of the investment of organizations. So like I said, we mentioned the historically Black colleges and universities. I also want to mention and uplift some of the Hispanic minority serving institutions as well, including the University of Puerto Rico. These are going to be some of the institutions that governments and philanthropic organizations, they are going to be doing, so they can take the lead on some of the research and some of the programming that's going to help communities find their way through not just this disaster, but future contexts. And more importantly, we have an entire generation that we still need to train up in the workforce. And so looking to those institutions to elevate is one example. The other side of that, of course, is elevating our leaders and elevating those people that are leading organizations and mutual aid networks, to making sure that we are sharing the mic and sharing the stage with organizations and entities that may not be as familiar to big funders, right, or traditional funders in communities. And so I'm sure the senator in Puerto Rico knows countless faith leaders and community leaders that he's been championing and sharing. So when they're having some of those big conversations, they know who they are as well. And then to the last point, right, in terms of collaborating and getting connected. So you heard about the voluntary organizations active in disasters. I dropped a few specific state links just based on the entities that are on this call today. But you have a collection of more than 50 members from the Salvation Army, American Red Cross, Lutheran Disaster Services, Presbyterian Disaster Assistance, Islamic Relief USA, and secular organizations. As well as partners. And that collective body are going to be other ways to get connected and collaborate. But I think one of the key things that we're learning, Charles, and you've been championing this, and CSG has been doing this through the micro summits the entire time, right? We need to center the lived experience and expertise of people who are most adversely affected. This is not about coming in and saying, I'm the expert, I know the language of emergency management, we're going to do it this way. This is about empathy. This is about being humble. And this is about realizing most solutions that are going to result in stick are going to be solutions that have buy-in from the community. So hopefully some of these groups and some of these tips help those leaders that are looking to support those people and work with those emergency managers to kind of take that role as well.
Senator, Majority Leader, we have a question here from Javier Cuevas while we got a few more moments remaining here. When we consider that Puerto Rico has suffered 2 hurricanes, multiple earthquakes, and a world pandemic in just under 3 years. So how should state and local government officials respond when they find themselves faced with what he's describing as an aggressive, probably a less empathetic federal government that appears to have little to no interest in helping the state or territory? If you'd like to weigh in on that question.
Well, first of all, I'm going to get political. Vote. Vote for people that care. Well, actually, because lives matter. Second of all, we are phased out. Current president he sees us either Republican or Democrat. I think Puerto Rico is a swing state, if you ask me. But it is political, and having no representation in Congress and the Senate, it makes it more difficult. So we have to borrow democracy from the states, meaning that I have to go to members of Congress and senators that do not represent me, but represent communities that look like me, and telling them that 3.2 million U.S. citizens live in an island in the middle of the ocean, like the president says, and you cannot drive there, and we have no political power. So saying that it's about coming to the office, knocking on doors, talking to federal government, getting the facts correct, and keep fighting. I mean, it's a ongoing fight for democracy and for surviving because of lack of political power in the territory. And that's a big challenge. I mean, I've been facing it for last 20 years. And I gotta be honest with you, we have gotten more attention after Maria because of the diaspora, which I don't think is a diaspora, but people, other communities caring about Puerto Rico. So it wasn't the federal government stepping up to the plate and saying, I'm here to help. It was people from Philly, from Baltimore, Virginia, Florida, Texas, California, people that came up and said, you know, that's wrong. What's happening in Puerto Rico is wrong. And programs like this, CSG, taking care of delivering the message, that's what really helped us to, shine a light and say, how can we fix this? And that obligated the federal government to say, well, you know what, we cannot ignore it anymore. We got to work on it. And that's it's an ongoing fight, to be honest with you.
Hey, Delegate, last word here. I'm real curious to get your thought on this. How do we get more people of color, particularly Black and Brown people who are on the front lines in the emergency planning and response decision-making room? I'm starting to have more and more of those conversations, and even white emergency management, emergency response professionals who are saying, you know what, I don't see diversity at all in these planning and response rooms when these disaster strikes, or when we're even before they strike, when we're planning for them or mapping out the response, they're even getting bothered by that. And so from your perspective, particularly in a state like Maryland, Maryland's about what, 35% Black?
Yeah, third.
Right, a third,
Yeah,
basically, yeah.
30%.
Yeah,
Yeah, so well,
think?
Sarah knows this because she actually works with me in my day job capacity, because I'm an assistant director for the Department of Planning for the City of Baltimore. So planning, emergency response, land use, careers, there's a lot of need for diversity, kind of all of the kind of intersecting careers. Right. So I think that there's a couple of things afoot. One, all of these agencies, whether they're state-based or municipality-based, they could be they could have better relationships with the institutions of higher learning in their footprint. It's kind of remarkable to me how often you'll have a government agency have like zero relationship to a course of study or a department that really is a pipeline into their career. And when you consider every state isn't going to be like Maryland with like 4 historically Black colleges, but I mean, right here in Baltimore City, we have 2, and we didn't necessarily have the best, I think, institutional relationship and pipeline. So that's something that I think from an equity perspective, it's not only the output of the work you do in emergency response that should have equity lens, your hiring practices, the way you can do business within your agency or institution also should be done with an eye towards equity. So some of that's going to be about, I mean, how do you even recruit in the first place your opportunities? Where do you even put your notifications for opportunities? I know that for us, we have created a committee just focused on pipeline. And it doesn't just start at the collegiate level. It's also about getting young people as young as middle and high school aware of an option. There's a reason why every kid want to be a doctor, lawyer, and an engineer, because that's like the only jobs we ever talk about all the time. And there's a million other jobs, and some of those jobs intersect with emergency response even. But I think that for us, we, at least within our planning agency, we launched a planning academy just for residents of Baltimore City, and we'll be launching a youth component of that, because we feel that some of your most active community members might actually be interested in this as a career option themselves too, because responding sometime as an emergency response professional, but in a layman's, kind of lane, they may not realize that they could harness some of the expertise they've gained on the ground and actually pursue it as a career path. So we're not just trying to empower people to be better partners with our government. We're also trying to empower them to consider this as a career path for themselves or for their neighbors, or to encourage young people in their life to pursue it. So I think we can't start too early, because kids are caught in the same emergencies that adults are in. They see what's happening around them. And I think that sometimes when we talk about equity, we often talk about racial and gender-based equity, but one of the equity prongs we're thinking about from our 4-prong equity lens within the city of Baltimore is transgenerational equity. The U.S. Sustainability Directors Network, that's one of their 4 prongs, is transgenerational equity. Are we placing undue burdens on future generations? And every time we don't better prepare for the next disaster, we have failed at transgenerational equity.
Delegate Smith, I'm going to give you the last word because we're running on time here. That was Delegate Stephanie Smith, representing parts of Baltimore and Maryland, and with the House delegate in the Maryland House there. Also, we've been listening to State Senator Carmelo Rios, who is Majority Leader of the Puerto Rico State Senate. He's been joining us as well. Sarah Baker, welcome, Healthcare Ready, Programs Director for Healthcare Ready, and thanks so much for also having Healthcare Ready partner with us. Go to healthcareready.org to make this convening, this micro summit possible. Marcus Coleman of HWC Inc., another one of our partners, also helping us make this possible, this micro summit possible. Thank you so much. And Chandra Brown of Lifeline Services Counseling in Mobile, Alabama, also taking time out of her Friday morning to make this micro summit possible. A great conversation. I'm sure we could go on for more time, but I don't want to take everyone from their Friday afternoon. I want to make sure I give you your Friday afternoon back, which should be here shortly. But do appreciate everyone's time. Thank you for also our attendees, and thank you for the questions. We didn't get to all of them. I think there were a couple more questions, but we'll post that elsewhere. I want to thank our attendees for listening and great participation and interest in this micro summit entitled, Are You Ready for the Next Disaster? Emergency Preparedness and Response During a Time of Pandemic, Protests, and Climate Crisis. There's a lot going on. We've got to get prepared for it. You can go to csg-erc.org. This micro summit will be posted elsewhere on social media, on CSG ERC's website, also at healthcareready.org. You can find it at thebenote.com a little bit later on. We will repost this, and on social media at #healthcareready for more there. And we will have future CSG ERC Healthcare Ready partnered micro summits as well, where we discuss issues like this and others too. I'm Charles Ellison, host of and executive producer of Reality Check on WURD. So listen in Mondays through Thursdays, excuse me, at 10 a.m. Eastern, and also go to wordradio.com for the live stream as well. I'm at Ellison Report on twitter.com. Once again, thank you everyone for joining us this Friday morning. Enjoy the rest of your Juneteenth. Please have a happy, restful, and reflective, safe weekend. And we will see you during the next micro summit. Take care.
Thank you.
Thank you.
Thank you.
All right. Thank you, everyone. Take care.
Thank you.
All right.
Thanks, everyone. Good to see you.
All right, good to see you. Okay.
Hey.
Marcus, thanks so much for those links, man.
Yeah, and like I said, I'll reach out to you, and then let's do a follow-up for sure.
Excellent. Let's do that. We'll do that sometime real soon. Take care,
yes.
bro.
All right. Take care, man. Thank you. And thank Debbie too. I'm sorry. Yeah,
yes,
apologies
thank you,
about
Debbie.
all of that. Yes.
No, you're welcome.
Yeah,
You're
thank you,
welcome.
Debbie. Let me let you go. I'm leaving now, Debbie. Let me let you
All
get
right.
to your stuff.
All right. Bye.
Take care now. Bye-bye.